I am Dr. K.AMUDHA from Biochemistry department. In today's topic, we can see what is leukopenia, leukemia and leukocytosis. When you see over leukopenia, the blood has different types of blood cells, including white blood cells or leukocytes. The WBCs are the important part of the immune system, helping the body to fight off disease and infections. So when you take a leukopenia, it is too few WBCs are called as leukopenia. There are different types of leukopenia, and this depends on which type of WBC when the blood is low in, that is basophils, eosinophils, lymphocytes, monocytes and neutrophils. Each type protects the body from different types of infections. Among this, the neutrophils protects the body from fungal and bacterial infections. When there is decrease in neutrophils, it leads to leukopenia. People use the terms leukopenia and neutropenia interchangeably. Another common type of leukopenia is lymphocytopenia. So the lymphocytopenia is too few lymphocytes are called as lymphocytopenia. The lymphocytes are the WBC that protect from viral infection. So when you see the symptoms of leukopenia, we cannot notice any signs of leukopenia. When the white blood cell counts are very low, may have the signs of infections like fever higher than 100 degree Fahrenheit and chillness of the body and sweating. We'll see the causes of leukopenia. Many diseases and conditions can cause leukopenia. Blood cell and bone marrow conditions includes aplastic anemia. Aplastic anemia in the sense it is a rare condition in which the body stops producing enough new blood cells, and this occurs as a result of bone marrow damage. And next is overactive of the spleen. Then next is myelodysplastic syndrome. So this myelodysplastic syndrome, it is a group of disorder caused when something disturbs the production of the blood cells. And some types are it is of unknown cause, and others occur in response to cancer treatments or chemical exposure. And next is myeloproliferative syndrome, and this is of course a disease of the bone marrow and blood. This disease progresses slowly and little treatment is required, and other times it develops into acute myeloid leukemia. And the other condition is myelofibrosis. So myelofibrosis, it is an uncommon type of bone marrow cancer that disturbs the body normal production of blood cells. And this is also caused due to cancer and treatment of cancer. Different types of cancer including leukemia can lead to leukopenia. The cancer treatment can also call leukopenia including chemotherapy, radiation therapy and bone marrow transplant. This is also caused due to infectious disease like HIV or AIDS, and also due to tuberculosis. And autoimmune disorders that kill WBC or bone marrow cells which make blood cells can also lead to leukopenia. And rheumatoid arthritis and malnutrition also causes disease. The malnutrition, it is caused by vitamin and mineral deficiencies. So especially B12 and the minerals like folate, copper and zinc. And this is also caused due to medications like penicillin, sodium valproate, steroids, etc. We'll see the diagnosis of leukopenia. When you want to see leukopenia, you are supposed to take complete blood count. And after that, the treatment is started. This treatment depends on the type of WBC which is low, and we have to find out what's causing it. And after that, the treatment is started. So the first treatment we can go, it is medications. Medications can be used to stimulate the body to make more blood cells against fungal infections, or else antibiotics to treat bacterial infections. The next treatment is stopping treatment that causes leukopenia. So stopping treatment in the sense it is stopping chemotherapy to give the body time to make more blood cells. The blood cell counts may naturally rise when treatment like radiation is over or between chemotherapy sessions. So next we can go for the next treatment, it is growth factors. It is granulocyte colony stimulating factor and other growth factors derived from bone marrow can help in the cause of leukopenia if it is genetic or caused by chemotherapy. These growth factors are proteins that stimulate the body to produce white blood cells. The diet for leukopenia includes an immune compressed diet, also called as low bacterial diet, may be recommended if WBCs are very low. This diet is thought to reduce the chances of getting germs from food or because of the way food is prepared. Next we will go for preventing leukopenia. We can't prevent leukopenia, but actions can be done to prevent infections when WBC count is low. That's why treatment includes eating well, resting, and avoiding injuries and germs. Next we will see leukemia. Leukemia, in the sense it is an overproduction of abnormal WBC, is called as a leukemia. And this affects close to 45,000 people in the US each year. The most common type of blood cancer in people is older than 55, but it's also the most common cancer in children under 15. These blood cells are not fully developed and are called blast or leukemia cells. We'll see the causes of leukemia. This leukemia occurs when abnormal white blood cells in the bone marrow quickly increases and destroys the normal blood cells. This leaves a person prone to infection very easily. The treatment approaches for leukemia depends on the type of WBC affected and whether the disease is acute or chronic. So acute leukemia, that is the one which forms rapidly and becomes severe very quickly. And chronic leukemia, this is the one which grows more slowly and takes longer time to advance. Types of leukemia. There are 4 most common types of leukemia, and they are acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and the other one is chronic myeloid leukemia. We will see all the 4 types one by one. So coming on for the first type, it is acute lymphocytic leukemia, and shortly we can say this as ALL. And this leukemia is more common in children. This type begins in the B or T lymphocytes, which are immature WBCs. The lymphocytes are the building blocks of the lymphoid tissues that make up the immune system. This affects the bone marrow all over the body. It can also spread to the lymph nodes, liver, and to the spleen. The second type is acute myeloid leukemia, that is AML. This is the most common type of acute leukemia in adults. The first type occurs in the children, whereas the second type it occurs in adults. It tends to progress slowly. It can affect any component of the blood, and there are many subtypes of AML. The blood stem cells in the bone marrow form into either lymphoid cells, which become white blood cells. The myeloid cells, which can become the red blood cells, white blood cells, or platelets. In acute myeloid leukemia, the myeloid stem cells usually mature into abnormal myeloblast or white blood cells, but they sometimes become abnormal red blood cells or platelets. As they multiply, they overwhelm the normal cells in the bone marrow and blood. The cancer cells can also spread to the other parts of the body. So coming on for the next type, that is the third type, it is chronic lymphocytic leukemia, that is shortly CLL. This accounts for about a third of the leukemia diagnosis. This usually affects the older adults. One form of CLL progresses very slowly and the symptoms may not appear until years after onset, and another form of CLL grows very quickly. The CLL begins in the B lymphocytes. As the abnormal cells proliferate, they crowd out the normal cells. More subtypes of CLL exist that affect other types of cells. The fourth type is chronic lymphoid leukemia, shortly as CML. This is a very rare type. Only 10% of leukemias are chronic myeloid leukemia. Adults are more likely than children to get CML. CML occurs when a genetic change turns the myeloid cells into immature cancer cells. These cells then grow slowly and overwhelm the healthy cells in the bone marrow and blood. There are subtypes of CML and this can form very quickly. This type is hard to treat and the type is hairy cell leukemia. This hairy cell leukemia, it is a rare type because of how it looks under the microscope, and this affects fewer than 6,000 people each year. This HCL, that is hairy cell leukemia, grows slowly. Some people live with this disease for many years before symptoms appear. Diagnosis of leukemia. No screening exams exist for leukemia. The specific diagnosis tests such as blood test, spinal tap, and bone marrow biopsy. By this method only we can diagnose leukemia. Signs and symptoms. Each type of blood cancer is different, but signs are the most common symptoms in children are easily bruising, pale skin, fever, and enlarged spleen or liver. Some people may not have any symptoms until the disease is advanced, or sometimes the symptoms may be mistaken for a fever, cold, or flu. Some common blood cancer symptoms include coughing or chest pain, fever or chillness, frequent infections, itchy skin or rashes, loss of appetite or nausea, night sweats, weakness and fatigue, shortness of breath, and swollen, painless lymph nodes in the neck. Blood cancer diagnosis and staging. The staging is a process that tells the spread and severity of the cancer. The diagnosis and staging often happen at the same time. The test and procedure to diagnose blood cancers may include blood test, bone marrow examination, diagnostic imaging tests such as CT scan, PET scan and X-ray, through physical examination, and surgical lymph node removal. The staging test lets each member of your care team know the exact type, location, and spread of cancer. Staging systems are rather consistent for cancers that affect organs and other tissues, but blood cancer differs. Each type of blood cancer has its own staging criteria. Next, we'll go for the blood test. Blood test can include a complete blood count, that is CBC. This shows the levels of RBCs, WBCs and platelets. The hemoglobin, that is the protein that carries oxygen to other tissues. Hematocrit is a measure of red blood cells in relation to the amount of plasma. An abnormal number or proportion of any of these can mean the presence of blood cancer. Blood test can also assess the blood's ability to clot properly. The blood sample is seen under a microscope will check the shape of the red blood cells and count the WBC cells. Through flow cytometry is used to look for certain proteins on the surface of the cells. By tagging a specific antibody with fluorescent dye, they can see if it's able to locate the proteins in question. The genetic testing for specific mutations and molecular markers can reveal damaged chromosomes that cause certain blood cancers. We'll see how blood cancers are treated. So the treatments for blood cancers includes stem cell transplantation, that is bone marrow transplantation, immunotherapy, chemotherapy, behavioral medicine, that is the psychiatrist can help to create a plan for meeting the challenge of blood cancer. And the next treatment is nutrition for blood cancer. And the nutritionist can design a diet plan to help to regain strength or support for the health of the patient. And blood cancer pain management. It is a palliative care. This improves the quality of the life of the people whose blood cancer is no longer responding treatments. And the next one is transfusion therapy. That is a method for improving healthy blood cells or platelets to replace cells destroyed by disease or treatment. Drugs for blood cancer. Induction chemotherapy to bring about bone marrow remission. For adults, standard induction plans includes prednisone, vincristine and anthracycline drug. The other drug plans may include L-asparaginase or cyclophosphamide. For children with low risk of lymphoblastic leukemia, that is ALL, standard therapy usually consists of 3 drugs, that is prednisone, L-asparaginase and vincristine. This is for the first month of treatment. So next is consolidation therapy or intensification therapy. This is to eliminate any remaining leukemia cells. There are many different approaches to consolidation, but it is typically a high dose. So, multi-drug treatment that is undertaken for a few months. The people with low to average risk for all, that is lymphoblastic leukemia, receive therapy with anti-metabolic drugs such as methotrexate and 6-mercaptopurine, that is 6-MP. People who are high risk receive higher drug doses for these drugs plus additional drugs. The next is CNS prophylaxis, that is preventive therapy. This is to stop the cancer from spreading to the brain and nervous system in high risk people. For this, the standard prophylaxis may include radiation of the head and or drugs delivered directly into the spine. The next is maintenance treatments with chemotherapeutic drugs. This is to prevent disease recurrence once remission has been achieved. The maintenance therapy usually involves lower drug doses and may continue for up to 3 years. Alternatively, allogenic bone marrow transplantation may be appropriate for high-risk patients or relapsed people. The next topic is leukocytosis. So, leukocyte is the other name of white blood cells. These are the cells in the blood that help our body to fight against infections and some diseases. When the number of white blood cells in a body is higher than normal, it is called as a leukocytosis. That is, normal விட WBC cells வந்துட்டு பாடியில் அதிகமாக இருந்துச்சு அப்படின்னா that is called as a leukocytosis. This usually happens because you are sick, but sometimes it is just a sign that your body is stressed. Leukocytosis is classified by the type of WBCs that's increased. The 5 types are neutrophilia. This is an increase in WBCs called neutrophils. They are the most common type of WBCs, accounting for 40 to 60% of the WBCs. Neutrophilia is a type of leukocytosis that occur most often. The next one is lymphocytosis. About 20 to 40% of the WBCs are lymphocytes. An increased number of these cells is called as lymphocytosis. This type of leukocytosis is very common. Coming on for the next cell, it is monocytosis. This is the name for a high number of monocytes. This cell type makes up only about 2 to 8% of the WBCs. This monocytosis is of course uncommon. Next is eosinophilia. This means there are high number of cells called eosinophils in the blood. These cells make up about 1 to 4% of the WBCs. Eosinophilia is also an uncommon type of leukocytosis. So coming on for the last type, that is basophilia, there is a high level of WBCs called basophils. They are not many of these cells in the blood. Only 0.1 to 1% of WBCs, and basophilia is very rare. Each type of leukocytosis tends to be associated with a few conditions. Neutrophilia is associated with infections and inflammations. The lymphocytosis is associated with viral infections and leukemia. Monocytosis is associated with certain infections and cancer. Eosinophilia is associated with allergies and parasites. And basophilia is associated with leukemia. Signs and symptoms of leukocytosis. The following are common symptoms: fever, bleeding, feeling weak, that is tired or even sick, feeling dizzy, faint, pain or tingling in the arms, legs, and even in the abdomen. There is trouble in breathing, thinking, and even for seeing, losing weight without trying, or a poor appetite. Causes of leukocytosis. Causes of leukocytosis can be classified by the type of WBC present. We'll see the causes of neutrophilia. This causes infections, anything that causes long-term inflammation, that is including injuries and arthritis, reaction to some drugs such as steroids, lithium, and some inhalers, some kinds of leukemia, a reaction to emotional or physical stress from things like anxiety, surgery, and also during exercise, removal of the spleen, and smoking. Causes of lymphocytosis. This causes viral infection, whooping cough, allergic reaction, and some kinds of leukemia. Causes of eosinophilia. It causes allergies and allergic reactions, including hay fever and asthma. Easily it is prone to parasitic infection, some skin diseases, and lymphoma. So coming on for the causes of monocytosis, infections from certain things like virus and fungus, autoimmune disease, and having spleen removal. The causes for basophilia is leukemia or bone marrow cancer and occasionally allergic reaction. We'll see diagnosis. Normally, the level of WBC should be 4000 and 11,000 per ml of blood. Anything higher is considered as leukocytosis. When the WBC counts is between 50,000 and 1 lakh per microliter, usually mean a very severe infection or cancer somewhere else in the body. There are 3 tests to determine the increased level of WBC than the normal. So coming on for the first test, it is complete blood count with differential. This test is almost always done when the WBC count is higher than normal for unknown reason. So to conduct this test, blood is drawn from the vein and run through a machine that identifies the percentage of each type of WBC. Knowing which type has higher than normal percentage can help the doctor narrow down the possible causes of the high WBC count. The next is peripheral blood smear. This test is done when neutrophilia or lymphocytosis is found because the doctor can see if there are too many of the different types of leukocytosis. For this test, a thin layer of the blood sample is smeared on a slide. A microscope is then used to look at the cells. The next test is bone marrow biopsy. WBCs are made in the bone marrow and then released into the blood. When a high number of certain types of neutrophils are found on the peripheral smear, the doctor may perform this test. The samples of the bone marrow are removed from the center of the bone. It is usually in the hip region with a long needle and examined under a microscope. This test can tell the doctor if there are abnormal cells or a problem with the production or release of cells from the bone marrow. Treatment for leukocytosis. Treatment of leukocytosis is based on what's causing it. Antibiotics for any infection, treatment of conditions that cause inflammation, and chemotherapy, radiation, and sometimes a stem cell transplant for leukemia. Medication changes if possible if the cause is a drug reaction. Treatment of causes for stress, anxiety if they are present, and hyperviscosity syndrome is a medical emergency treated with intravenous fluids, medications, and other methods of quickly getting the WBC count down. This is done to make the blood less thick so it flows normally again. In this topic, we have seen what is leukopenia, leukemia, leukocytosis, the types of these, the causes, the symptoms, and the treatment and the preventive measures which can be done. Thank you. Thank you. Thank you. Thank you.